Hello, everyone. Welcome to the first edition of Revive Conversations, our quick hit conversation series focused on meaningful, actionable strategies for strengthening workplace well-being. My name is Humberto Chacon with the customer success team, and today we're joined by John Lufburrow, CEO of Revive, a seasoned leader in employee support and culture building, to explore the theme of creating a culture of care. In the next 15 minutes, we'll dive into how organizations can foster genuine care for their people and how Revive can play a role in making that happen. Welcome, John.
Yeah, thank you, Humberto. Happy to be here.
Yeah. Please tell us a bit about Revive Health and how it was born out of the frustration with the friction and the difficulty of the traditional U.S. healthcare system.
Yeah, happy to. So we started this company because we could see that there were a lot of challenges with what we call the traditional healthcare system and traditional benefits. And we could see a very clear unmet need in the market with employer health plan sponsors, struggling to find solutions that would solve for access and affordability. And so access and affordability oftentimes are the prevailing barriers in healthcare. And so we wanted to create a really easy way for health plan sponsors to be able to solve for those barriers, overcome those challenges, and do it in a simple and seamless way. And so our founders and many of the people in the beginning of this organization, were longtime leaders and visionaries within healthcare. They had been in the traditional system, working for either big carriers or big health systems, and they could see what wasn't working, right? And even the basics, and that's what we'll talk about today. But the real basic needs that people have around health and living their best life aren't easily met, and so you have to disrupt and innovate. And so we created this company that's designed to be really kind of the antidote to all the things that don't work in the traditional system. And we're quite proud of what we've done and how we've built it to this point. But that's the goal, is to make healthcare easier, because if we can do that, that allows employees and their dependents to be at their best. And it creates a more productive workforce. It creates a more engaged workforce. And whenever you allow people to be their best, they usually show up at work at their best. And that really is our focus, and that's our goal. And we've had a tremendous amount of success in the last 6 years, as we've kind of evolved this model that we've built. And really, the end goal is, how do you help people be as healthy and as productive as possible while you create a really rich landscape. And if you can also help to lower the total cost of care, which Revive does, that's an added benefit for the plan sponsor.
Great. Wow. Thank you for telling us about that. Can you tell us a bit about Revive's integrated whole person health model?
Yeah, so we didn't want to be just a point solution. We wanted to be a partner for an employer that can help folks with what we call integrated whole person care, which is, mental health, physical health, medication health. We think holistically when we think of our patients, our members, and oftentimes these things are intertwined, right? And so you've got to build a platform, you got to build a solution that allows providers to work together, that allows people to get treated kind of holistically. And that's really what the integrated whole person care model is about. And I know we've got a slide that kind of shows it
Yeah, why don't we
in
go
a
to that?
diagram. But that's the concept. So if you see that triangle on the right hand side of this slide, everything we do puts the member front and center, right in the middle. But being able to create mental health solutions where people can get care, whether it's one-to-one counseling with an expert counselor, whether it's self-care through our dynamic application, or it's in the moment kind of I need help right away care. We do that on the mental health side. We also do physical care, and so physical health. This is opening up primary care, allowing people quick access for everyday or 24/7 urgent care needs, all the way through to virtual direct primary care. And it's our physician group that's all US trained, board certified, and have a minimum of 10 years of clinic experience. And they're helping people with everything from primary care chronic conditions to, hey, I don't feel well today, or, we're right in the middle of cold and flu season right now, where a lot of
Mhm.
people are struggling and you're seeing a lot of absenteeism. and Revive can help people get back onto that healthy track, which is something we do in an expert way every day. And then the third kind of big part under our model is medication health. And so
mm,
what we saw was a lot of people across the country were struggling to afford their medications. About 30% of people drop off of their chronic condition or their maintenance medications. Usually it's because of cost. And so we own two very large mail order pharmacies, and we've created several pharmacy programs that run in conjunction or adjacent to maybe a PBM benefit, but it allows people $0 access to over 1,000 medications, and these make up about 80% of the most commonly prescribed medications in the country. And that helps people by getting that 90-day supply at no charge, no cost for shipping or even processing. People will stay on their medication, and that'll help with healthier outcomes, right? So we'll have greater persistency. So we've built that. We've also built some international sourcing for specialty medication programs, and then some other interesting programs around weight health.
mm,
And so when you combine these things and you start to put the patient or the member at the center and you think of them holistically, you can provide this really rich benefit through Revive without taking away from the plan sponsor's existing benefit strategy, but really
mm,
complementing it or augmenting or supplementing it. But you end up with this really rich environment where people can, with for no cost to them, no copay, doesn't generate a claim. They can go in
mm,
and talk to a doctor. They can talk to a counselor. They can get medications transferred into our program and afford their medications. And when those things happen and they come
mm,
together beautifully, you usually see this real nice enhancement to the benefit offering from the employer. And you also
mm,
see this lower total cost of care because you're redirecting what would be claims in the traditional, more expensive fee for service system into Revive's program. And it works very similar to an on site health and well being center or an on site
mm,
clinic, but it's all in the virtual realm. So it's affordable and it's predictable and it's easy for people to access. We also think the way we put this together and the way the platform comes together for members is more in line with how people are experiencing a lot of other things in their life. It's on demand, it's simple,
mm,
there aren't long forms, there isn't a lot of friction, there's no claims, no EOBs. It's just a very clean way to connect people with providers or
mm,
with the medications that they need. And we've had tremendous success bringing this model in, whether it's integrated into the broader benefit plan design or whether it just sits on top of it, right? And it's a place that people naturally go to because it's very inexpensive for them.
mm. Can you tell us a little bit more about the weight health portion?
Yeah, so Weight Health is a really fascinating program. We created this 2 summers ago now and launched it 1/1 of 25. But this is the first comprehensive weight health solution built and designed specifically for self-funded employers. It works for all sorts of types of employers, but we really built it with that self-funded employer in mind. A lot of them were coming to us and saying, "Look, we are seeing a lot of spend in the category of branded GLP-1s for weight loss. We need to
Mhm,
get control around this. We believe that a lot of these medications are being written without a lot of the support that needs to go with it. So we created this all-in-one program that has it's physician supervised. It has our mental health and health coaches involved in the whole process, and it leverages our pharmacy program where we've put together a formulary of FDA-approved weight loss medications. Yes, it can include branded GLP-1s that can be a part of
mhm,
a person's journey, but we do a careful assessment up front. We create these tailored journeys because everyone's on a different journey, has different experiences, and it comes together with that health coach being kind of the accountability partner, guiding them and giving them tips and support around nutrition and healthy lifestyle habits, exercise, all of these things that are key. So we're kind of changing the medication from being the centerpiece of the journey
mhm,
to the real stuff that's going to help them with long-term outcomes. And the medications can be used by our physicians to help them maybe get started or get through the first 12 months of that journey. But it's designed to give a lot of control. And what this
mhm,
does, when you put control into an area where you see a lot of spend, you're going to see a lower total cost of care. And we see 30 to
mhm,
$50 PEPM in hard dollar savings to the plan with our
mhm,
weight health program. And so again, it's a broad program. It leverages more than just GLP-1s, but it can address the problem of excess GLP-1 spend for any plan sponsor.
Well, that's great. Thank you for explaining that.
Yeah.
Uh, John, when you talk about a culture of care, what does it actually look like on a practical day-to-day level for employees and managers?
Yeah, so this is the most important thing to us, right? We want to be a partner with every employer out there in helping them create this really strong culture of care. And what we mean by this is, if an employer is doing all the right things to help people be at their best and to be healthy and engaged when they show up to work, be more productive, living their best life, you're going to have a really strong workforce, right? And so it starts with an intentional decision to say, we're going to find a partner that can help us upgrade and build this culture of care. And that's what Revive does. That's our main goal for you. Our main goal is the success of our customers. And we can do a variety of different things, as we've kind of explained. We can put together custom or bundled, tailored packages to kind of get there. But that's what we want to work with each and every employer on, is creating this really strong culture of care. And sometimes you have to think abstractly about benefits. Sometimes you have to think outside the box and look at other partners. And one example I want to share to
Hmm.
everybody out there is, we were fortunate enough to engage with a college in Pennsylvania that came to us last a couple summers ago. And their problem was they had pulled every traditional lever, rate, increased premiums, contributions, all these things. Their benefits weren't very attractive to their employees. They were having turnover, even with professors, leaving and going and teaching at other schools. And so they said, we need a lot of help. And once we sat with them and in a consultative way worked with them, uncovered some weak areas in their benefit offering today, and talked about how Revive can close those gaps for them. And so we added mental health. We added our primary care, our 24/7 virtual everyday care, added our medication program, put this in place, got it launched with their benefit year. And in the very first 2 quarters, they had over 70% of their population engaged in our program.
Wow.
They were seeing a reduction in their pharmacy spend by 19%. And the biggest thing is all of the anecdotal stories and the thank yous that were coming from their workforce saying this was just the greatest thing you could have done. And they didn't have to change any of their plan design or their contribution
Hmm.
strategies. They just added Revive as a layer, and it was affordable for them to do it, and it's paid for itself already. In the first 6 months, we were already at a 4-to-1 ROI. So it's very easy to measure Revive's impact. And that's a good example of how quickly we can get in and really kind of change the trajectory and help to create a culture of care within an employer.
That's great. Wow. Thank you for sharing that. Really appreciate it. And thank you for all the information today, John. It's great to hear more about Revive. If folks would like to continue the conversation, here's our contact information. Please reach out to us. The next Revive session is going to be on weight health. And so that'll be on March 19th. Stay tuned for more information about that. And until then, be well. And thank you, everyone. Take care.
Thanks, everyone.
All right,
Bye.
bye.